Hi, my name is Tanya Least. I was diagnosed with metastatic breast cancer in December of 2017, and I wanted to share a bit about my treatments with Enhertu. That's spelled Enhertu. And I wanted to talk about some of my symptoms, some of the things that we found that work for those symptoms, and go through a quick timeline for you. And so I started Enhertu in October of 2024. In May of I started that in October of 2023. In May of 2024, we reduced by 20%. I had been at max dosage up to that point, and then having an issue with nausea and vomiting, we talked about it and decided to reduce it by 20%. And so I just had my last dose of Enhertu August 20th of 2024. Looking at this, I was progression free for 6 months, which means that my cancer was stable and not moving for 6 months. After that, I started to see a flare up in my pelvis hip area, and with the cancer, and also in the liver. And we decided to hold just for another 3 months. I'll be going back in for my 3-month PET scan, and we will switch treatments at that time. So let's see. So I was progression free to April 2024. And forgive me for looking down. I'm just reading some of my notes. Some of the symptoms that I've experienced with Enhertu is the second week nausea and vomiting. Apparently, this is a very common thing with patients that are on Enhertu. I know I've met a couple of patients that are going through the same thing. And so we developed, my oncologist, my local oncologist and I developed a method to curtail a lot of the nausea and all of the vomiting in that second week. I was actually admitted to the hospital. It had gotten so bad that I couldn't stop vomiting. And so that at that time, that's when we reduced it by 20%. Started the Friday after my treatments on Tuesday, I would go in for an infusion of Emend, E-M-E-N-D, for nausea, and Steroid. And then the following Friday, I would go in for another infusion of Emend and Steroid. And this would get me through that second week. When you experience this nausea, it is a very fast onset. I try to take medication as soon as it hits because it can get very bad. And sometimes I have been able to catch it and have no issues, and other times it leads to vomiting, but not to a point where it's not stoppable. And so that's one thing to look for, is the second week nausea and vomiting with the Enhertu. Neuropathy is also a common symptom. I do ice. I ice my hands and my feet, and this has prevented neuropathy from setting in. And so I do that every time I have a treatment. Another symptom that we found that I've had is dry eye. Now, I had dry eye prior to taking Enhertu, but this really really made it a lot worse. So if you already experience dry eye, be very careful with this. Make sure that you're taking drops that do not have preservatives. I personally use Refresh eye drops. I use them 4 times a day, and keeps my eyes very lubricated. Make sure that I'm blinking a lot. I've gone to an optometrist because I started having vision changes. I see double and triple vision as well as blurry vision. This was a very quick onset. I would say probably within a few days to a week, my eyesight changed. And that prompted me to go to the doctor, to the optometrist. What she found was that my corneas in both eyes are scratched because because of the dry eye. It was so bad, and I did not realize that I was having that kind of issue with the dry eye, and so it scratched both corneas. Now going to go to an ophthalmologist and see what we can do about trying to treat that. Also, one thing that you'll find is you may find most patients do, reduction in your white blood counts. And for that, I'm taking the Neulasta. It's the box that goes on the back of the arm or on the stomach. Amazing invention, amazing. It counts 27 hours, and then administers the medication. Then I remove the box from the body. And that has, I do see an increase in my white count and am able to get my infusions. Lastly, one thing that I'm experiencing from a lot of steroids is the moon face. You get these pockets that start to appear, and you get a very rounded face, and they call this moon face. And so I had a rather elongated face to begin with, but now with the steroid use, it has really turned into a moon. So that's another side effect from taking so many steroids. But they help, and I can certainly deal with the moon face. So I just wanted to share my experience. Feel free to reach out if you have any questions, and I would be more than happy to share my experience and what works for me with you. I appreciate your time as always. Thank you for your prayers. Thank you for all the positive thoughts. I know that this has gone on for a long time, and I'm very, very happy that it has. But it's only been through your prayers and God's hand that I've been able to live a great life during this time. So thank you all for your support, and I hope to see you soon. Thanks.